We're going to start, we're going to jump right into it. We want to say a very special thank you for taking the time off to have that discussion with us. And we're going to be talking women's intimate health and hygiene. So before we get the ball rolling into the questions, just going to ask you to introduce yourself for persons who probably not familiar with who you are.
Okay, so hi, my name is Lynthia Buckmire. I am the senior nurse here at the Grenada Planned Parenthood Association.
So pleasure to have you again. So we want to discuss the issue of women's intimate health and hygiene. And it would lead me to my first question, which is, what are some common misconceptions about female genital hygiene and how can they be addressed?
Well, for your first questions, there are a lot of misconceptions about female genital hygiene. And to get right into it, the first one you have that persons think that they need special products to clean their vaginas. And then you have they think that vaginal discharge means odor is a sign of an STI. Douching, which we find that women do on a regular basis. They think that douching would help balance off their pH. And it's not only douching, it's like using other products that you have to insert, like they have the herbal egg that they make now that is out on the market, that you have to use these things to help maintain and keep your pH in balance. Using feminine sprays, that these are not harmful, and have the underwear choice. So that they think underwear choice is not a big something. You could wear whatever underwear that you feel comfortable in. So that are some of the misconceptions that we have out there. To curb or to change those misconceptions, we have to educate our young women and ladies. We have to educate them, give them enough education about how to properly take care of their vaginas, what are the things that are needed to keep themselves healthy, some of the things that are out there that might be, popular on the market, but not necessarily healthy for them to be using. So we have to educate them early and enough, give them the information openly, so then they will know exactly what to use, what not to use, what to do, when to visit the proper health professionals to get those kind of information.
And what are some of the do's and don'ts for vaginal care? For example, should one go to pap smear on their period, etc.? Those kind of things.
Okay, so some major do's and don'ts for proper vaginal care. One of the first one is don't douche. We might think douching is healthy, but it is not. Douching actually would affect your normal vaginal pH. Now, our vaginas are self-cleaning. What we might say is our vaginas are automatic. So they don't need anything to be clean. They usually would clean themselves. So douching, once you insert the douche, it doesn't matter what it is, it would affect your pH. So it wouldn't make it better. It might actually make it worse. Our vaginas are naturally acidic in nature. So it's like 3.8 to 4.5 on the pH scale. So it's very acidic. And it being acidic would make it very difficult for unwanted bacteria and germs and other things to grow. So when we use these douches and these other things to insert, it actually would change the pH that it is from normally, right, acidic, and turn it alkaline, so that it would give room for this bacteria to grow. So one of the don't sorry is no deep douching. Don't use petroleum jellies. Normally, we know sometimes during sexual intercourse, you might need a little extra lubrication, and persons might look to using Vaseline. So Vaseline is not recommended. If you want any type of extra lubrication, you could use a silicone base or a water-based lubricant, the oil-based and things like the petroleum jelly usually would cause irritation, not for only the women, but also for the men. So petroleum jelly is a no-no. One of the do's, do choose the right underwear. So we encourage women to use more cotton. You could still use your fancy lingerie, you could wear your thongs, you could wear your laces and everything, but ensure if you're going to wear underwear for a long period of time, so you have to go to work, you have to go to an occasion where you have to be there for a very long time, choose a cotton underwear. Cotton underwear causes you to breathe more down there, right? So it allows more air to circulate down there. When you use the other underwears, it could create irritation, and it would make down the extra moist, which would lead to bacteria growing. And these are some of the things that would lead to us coming down with infections. So we encourage persons to use cotton underwear when they have to wear it for a long time. One of the other don't use the wrong tissue paper, right? There are two-ply tissue papers are the recommended tissue papers for us as women to use when we have to clean our vaginas. So you use the two-ply, which is softer. The one-ply is more harsh, which would lead to irritation. One of the don'ts again, don't ignore changes. So if you know you're normal as a woman and your vagina and how your discharge is supposed to be and everything, don't ignore when it changes. So whenever it changes, you seek the proper help immediately. You don't wait. You don't listen to outside advice where they would tell you use this and use that. You go to a professional where you would get the proper advice to help with your issues. One of the do's again, do practice safe sex. We encourage persons to use condoms as much as possible to prevent contraction of STIs, which would lead to problems, right? If you engage in risky sexual activities, we encourage you to, refrain from those activities that would, cause changes to your vaginal health. One of the do's again, do Kegel exercise. Kegel exercise is very easy to do. You could be sitting anywhere on the bus, you're driving to go to work, you're sitting in an office, you sit down in a waiting area, you sit down on the table having lunch, you do Kegel exercises, and the Kegel exercises are just you contracting and relaxing your pelvic muscles, the same pelvic muscles that you would squeeze when you have to urinate very badly and in an area where you can't do it. So that same muscle that helps you to hold that urine inside is the same muscles that are there to help, hold up the pelvic organs and everything. So when you do Kegel exercises, it helps to keep the area firm and nice. So we encourage persons to do Kegel exercises. One of the do's again, do change your sanitary napkins and other products on a regular basis. So when you have your period, or if on a regular you use panty shields, we encourage you to change it as often as possible. Once blood and these fluids and them settle for a long time, it leaves room for bacteria to grow. So change it often, so it would not encourage the bacteria to grow as regular. If you're in a situation where you could change your underwear during the day, if you work long hours and you could afford to change your underwear at least 2 to 3 times, if you know you sweat a lot, then do that as well. Once you remove those things that would cause bacteria to grow, the environment that would cause them to grow, then your vaginal health would increase and you would stay healthy. You would stay healthy.
A lot of great stuff. But I want to switch the topic over to hormonal changes. Does that have an effect on female genital health, and what's the step a woman can take to mitigate the negative effects of that hormonal changes?
Well, with hormonal changes, a lot of things can happen. For like women who are perimenopause or menopausal, we know with that comes decreasing estrogen, and estrogen usually would help with the lubrication of the vagina. So if we encourage women who are going through that, if they are experiencing things like that, a decrease in the lubrication, which would cause irritation down there, it would cause it to be more dry. So you check your health doctor, your gynecologist, and they could recommend for you estrogen creams or gels that you could use to apply down there that would help with the dryness. With other hormonal changes would cause maybe your discharge to be more than usual. So with the discharge being more, then you would have to use maybe panty shields or layers, other layers to help with the discharge. And like I said earlier, if you're in an area where you could change your underwear, often you do that as well to help with discharge. If you have unscented feminine wipes, you could use that as well to instances where it might cause bleeding. So you would have spotting. And with spotting outside the period, if you leave it and you don't attend to it too long, it dirties you and it would cause you to have a scent. So you change your panty shields and you use your wipes on a regular basis to help keep down the keep fresh and nice when these changes occur.
And also, as you on that in terms of navigating and so on, what are some of the potential signs of infection in a female, and at what point in time should they seek advice or medical advice for that matter?
Okay. Well, advice should be seek always. So I don't think we as women should wait. Once we have changes that are not or normal, we should seek advice immediately. We shouldn't wait. So you go to your gynecologist or you go to your nurse or you go to your doctor who would help you, would give you good advice as soon as possible. So you don't wait. Once it moves from the normal, once you know you're normal, then you seek advice. And some of the changes would be like burning. So you might have burning, you might have itching, you might have an increase in your discharge. The color might be different. It might be a yellowish, greenish. It might be even bloody discharge. When you're passing urine as well, because a urethra is right there in that area there within our vulva. Any burning, any blood when we're passing urine as well. If you're having difficulties during sexual intercourse, it might be burning as well. It might be pain. It might be bleeding. So things like that. Once it occurs, you seek attention immediately. You don't wait to see if it's going to go away. As long as it moves from the normal, whatever your normal might be, then you seek medical help immediately.
All right, and that would lead me to my other question, to how can women ensure that their intimate hygiene practices align with their overall health and wellness? So we want to merge the two.
Okay, so I think the major thing is women have to make the time. We make the time for everything else. We make the time to do our hair. We make the time to go shopping to buy the nice clothes, to go to the parties. We have to take the time to take care of ourselves. We rush to do everything else. Maintaining our vaginal hygiene should be at the top of our list, and we should take time to do it. So we, as women, we have to teach our young girls from a young age, early, how to properly take care of themselves, how we should wash our vaginas, how when we're in the bathroom, we're supposed to pat our labias and remove everything that's there, not just take the rag and wipe over it and everything like that. So we have to, make the time to properly take care of it, to clean it properly and everything. Eat healthy, drink less alcohol, maintain a healthy diet and things like that. Do all what we can to help our immune system and our overall health to, be positive, to stay healthy, and in turn, it will trickle down to the other areas.
What role does, because you touched a little bit on it, but maybe if you can elaborate a little bit further in terms of what role does diet and lifestyle play in supporting female genital health and hygiene? You touched on it, but maybe you want to elaborate in terms of the importance of the diet.
All right. So diets. In terms of that, there's always say we are what we eat. And there are cases where things that are high flavored or high scented, when we consume it, we would get the effects, meaning that it would come out from our sweat and everything. And we know that down there we have sweat glands as well. It's not necessarily when women have bad odor or strange odor, is that the vagina itself is smelling, but it's the sweat that has the scent, and when it moves together with the bacteria and everything that we normally have on our body, we'll get that odor. So when we eat high flavored food like onion and things like that, we usually would get the odors from that. So we have to try when we eat high seasoned food as well. We don't have the time to cook a good meal at home. We usually take a lot of fast food, so we have to try to eat more healthy so that these things would not trickle down and then we would get the effects of it after. Lifestyle wise, like I said, we don't take the time that is needed to take care of ourselves properly. We would do everything else, but we don't take the time to do that, to clean ourselves. When we engage in risky sexual behaviors, that could also lead to depletion in our health down there as well. If we have multiple partners, we're not using protection, which would lead us to coming down with STIs and other infections that could, decrease our overall health and our vaginal health. So we need to take better care, not engaging in risky sexual activities. If we have to do it, and it's something that we can't, stop, then we should take the necessary precautions, use protection and stuff like that. When we have to, change, when we have our periods on us, don't see it as a bother. When we use tampons, yes, tampons are good, but don't leave it in for too long. We might think it's convenient that it's there. We don't have to change a pad very often. But with the tampons, you still have to do the same changing, because after it gets full, it stays inside it. It's no longer outside there and it has to travel to go up. We already have it inside there. So it doesn't have to go very far. So we have to take like necessary precautions to take care of ourselves and to do the necessaries that is needed to help to keep our vaginas clean and healthy.
All right. And at what stage would you recommend young women to start having pap smears, and how far apart should a pap smear be?
Okay, so the standard age for women to start having their pap smears are at the age of 21. But we know these days we have younger girls who are engaging in sexual activities at an earlier age. So they might start 8, they might start 9, 10. Well, we wouldn't do a pap smear for a young person like that, but we would encourage persons, once they start having regular sexual intercourse, they should start thinking about having their pap smears done. And the specifications of when or how often a pap smear should be done is dependent on their situations. So for the normal, it may be about a year to every 2 years, 1 year to 2 years, you get your regular pap smears done. It might be more often if we did like previous pap smears and we have infections, or we might have other conditions that was picked up, then they would request pap smears to be done on a regular basis, more regular. But on a normal, 1 to 2 years, and as we get older, then the time period will increase maybe to every 3 years. And then once you have at least 3 to 5 pap smears before the age of 65, that is normal. After 65, you don't have to continue unless you have some condition or some issue down there that requires you to have a pap smear done by a doctor. then we would encourage. But on the regular, 1 to 2 years, and at the age of 21. But if you know you're engaging before that in sexual contact and everything, and you might have a high history, a family history of cervical cancer or issues like that, then we encourage you to get your pap smears done regular.
Right, and as we wrap up the conversation, how can healthcare providers support women in addressing concerns or questions related to female genital hygiene in a respectful and sensitive manner?
Well, for that question, I think we as healthcare providers, nurses, we should be comfortable to talk about it ourselves. There are a lot of us who, for ourselves, are not comfortable to talk about that. So we should be able to to be comfortable about it in order to, be able to speak to others about it. And in speaking to persons about it, we have to be open and we have to be non-judgmental, because there are persons outside there. We may think that there are things that they should know, but they were never taught. They don't know, what is it right, how they should take care of themselves, when, and how often they should do this or they should do that. So we as healthcare providers, we should be more open, we should be more non-judgmental, we should be more considerate, and we should be comfortable enough to speak to persons. And when you are comfortable and you develop that rapport with persons, there are certain things that you don't have to tell them. They will open up and tell you, and then it will give you the opportunity to speak to them about it. And then we should encourage them. Once these women come in, we should encourage them to have the conversations earlier with their daughters about what is needed, what they should do and what they shouldn't do, and how they should take care of themselves. So we should be, we should educate them more about the right things that they should be doing, so then they could pass it on to their daughters, their nieces, their friends and everything. And I think that's the way how we would get them to open up, to be more receptive into getting the help that they need if they have issues. So we should be able to speak to them about it openly, non-judgmental, and be comfortable about doing it. Don't be afraid. Even if you're coming and they do a procedure and you realize something is wrong, try as much as possible. You don't have to come out and say directly to them and to make them be offended about it, but you tell them in a nice way. You tell them about how it should be or what they should be doing, and then you open up the speaking area for them to tell you, what they know, what they don't know. It would give you the opportunity to tell them what they should know and what they should be doing.
All right. So I think we would have exhausted our time, but I want to say a very special thank you for the informative discussion, and I'm certain persons who are looking will be able to garner some much needed information from it. So on behalf of GrenCHAP and its supporting partners, we say a very special thank you for the time.
You're welcome.